Welcome to the OPWDD presentation on the Coordinated Assessment System, or CAS. In this presentation, we will talk about the OPWDD assessment called the CAS, the benefits of CAS, how the assessment works, and how it is used. Before talking about the CAS, it is important to know more about the history of assessment at OPWDD, where we have been, and where we are going with assessment. The process of developing and using a standardized assessment tool started in the early 1990s with the Developmental Disabilities Profile 2, more commonly known as the DDP-2. While the DDP-2 was a good and reliable instrument, its items and administration process has lost relevance and integrity over time. In many cases, the DDP-2 was completed without the person and/or family members even knowing. The CAS administration process starts with the person receiving services and their primary supports, ensuring the opportunity for people to have a voice and contribute to the information collected. In this way, the CAS is a more comprehensive assessment that better captures the unique strengths, needs, and abilities of the people seeking services or being served. OPWDD's comprehensive and conflict-free needs assessment tool for people who are 18 and older is the CAS. The CAS is person-centered and includes information about what a person is good at, what they may need help with, and what they enjoy and want from their life. The CAS assessment leads to information that helps guide a person's service planning. It also includes additional areas of need related to mental health, forensics, and substance use for people who have needs in those areas. The CAS assessment identifies the amount of support a person needs, including support currently being provided by family and/or other close supports, because this information should be considered as part of the care planning process. This might be especially important to consider if caregivers are feeling overwhelmed or not able to support all of the person's needs. For many years, OPWDD used the DDP-2 assessment tool alone, but feedback from people with disabilities, family members, and other stakeholders identified the need for a more thorough assessment that would provide additional information about a person and use a tool that included the participation of the person and/or family. OPWDD worked with stakeholders to find better options and ultimately chose the CAS for several reasons. An international network of researchers and practitioners known as InterRAI, whose mission is improving care for people who have disabilities and/or have complex medical needs, developed a tool that formed the basis for the CAS. Their expertise is in developing assessment instruments, and their instruments are rigorously tested. Today, InterRAI continues to review the CAS and its effectiveness to help improve it as needed. This is an important function and one OPWDD did not have with the DDP-2 assessment. The Federal Centers for Medicare and Medicaid Services, also known as CMS, requires states to use a conflict-free, comprehensive functional needs assessment tool. The CAS is comprehensive, meaning the assessment provides an overall understanding of the person. The CAS is also conflict-free, meaning the assessment is objectively administered or completed by someone who is independent from any service provider and has no vested interest in the findings of the assessment. The CAS meets these requirements for New York State. It provides more detailed information about the person and their support needs and is administered by independent CAS assessors. The CAS is a more person-centered approach than we had with the DDP-2 because it gets information from the person themselves and people who know the person well. When a person has been identified for assessment or reassessment, the Care Coordination Organization, or CCO, is notified, and the care manager will talk to and coordinate with the person or primary support and actively involve family member or legal guardian to let them know that an assessor will be reaching out to schedule a meeting for the assessment. Lastly, OPWDD is invested in understanding people's needs and making sure each person can receive services that respond to those needs, making access to our services equitable as outlined in our 2023 through 2027 strategic plan. The CAS helps us better understand what each person needs so the service system can deliver services according to what is needed. First, as noted, CAS allows for a more inclusive process, directly involving people with developmental disabilities and their family members. Because of this, the CAS process brings more transparency to assessment than the DDP-2 and creates a positive environment in which to talk about the needs, strengths, and challenges that a person experiences in their life. The CAS is very practical. The instrument is much more comprehensive than past assessments. It has a number of embedded assessment tools that help identify specific types of needs and the support that is needed to respond to those needs so service providers can adjust their delivery of services to be more tailored to what the person requires. Items like standing, eating, communication, and involvement in community activities are just a few examples of the areas the CAS covers. Because of how detailed the CAS is, it provides a fuller picture of the person in their everyday life than the DDP-2 did. This means the CAS is a great tool for care planning. Finally, the CAS is completed by an independent person who is not part of the service system. This is how the CAS works. 1. Information about the person is collected and includes but is not limited to psychological assessments, medical summaries, other clinical evaluations, educational records, and other information relevant to a person. This is information the care manager relies upon routinely to understand a person's needs. 2. The assessment information is gathered by trained professionals through interviews with the person, visits, past records, and from people that know the person well. People can ask anyone they want to participate in their assessment. 3. Based on the information collected in an interview and the information learned through review of the documentation, a summary is created, and within 30 days of the assessment, the care manager shares the summary with the person to help with person-centered planning. 4. The summaries are discussed and reviewed, and any questions or concerns may be shared with OPWDD. OPWDD conducts quality improvement checks and examines the quality of the CAS assessment process in several ways to ensure the information it gathers is accurate and reliable, and the assessment process is person-centered and successful for the people being assessed. This process repeats every 2 years, or as required, or sooner if needed. The CAS is not a list of questions, but rather a comprehensive collection of topical areas that are explored through a conversational style interview. The assessment is completed based on the information gathered from multiple interviews. This allows the assessment to be person-centered and focus on the areas that are important to the person. OPWDD also strives to complete assessments in the way that best suits the person's preferences. Therefore, assessments are completed both in person and virtually, based on the needs and preferences of the person. In-person assessments may be ideal for some people and are believed to better capture a person's strengths and needs because often the assessment occurs where a person is most comfortable. OPWDD fully supports in-person assessment. However, in consideration of personal health concerns or other preferences, a person may request that a CAS assessment be conducted virtually. Following completion of the CAS, summaries are electronically generated. Some of the information included in the CAS summary is demographic information, a person record view, strengths, to build on, such as skills, abilities, and relationships, etc. Needs, for instance, what the person's goals are, where they may need support, or what the person may want help with, and supplemental information about a person's mental health, forensic background, and substance use. These summaries are made available to support care planning when CAS has been completed. The CAS summary reflects the unique characteristics of each person, which leads to a more comprehensive understanding of a person as we move toward care planning. The person's CAS summary and documented strengths and needs provide a starting point for developing or updating the person's life plan, and are helpful in supporting identification of services, supports, and resources that may help address the person's unmet needs and goals. From this discussion, updates or revisions to the life plan may be needed. Some people have questioned why the CAS uses a 3-day look-back period, and if the CAS can identify timeframes up to and beyond 1 year of time in which a need arose. The CAS look-back is not limited to 3 days, and responses are structured in a way to support accurate understanding of current and past strengths and needs in order to inform care planning and acuity. The CAS uses a 3-day reference as it is a point-in-time assessment. Some skills that a person has are relatively constant, such as using the bathroom, bathing, and making a meal. In those instances, having a conversation about the last 3 days with the person and/or others who know the person well makes sense, as beyond 3 days, memory tends to not recall details fully. The CAS also captures information beyond a 3-day look-back by identifying, for instance, if a behavior, health condition, life event, need, or skill is present. This approach helps to account for more acute needs, low-frequency needs, traumatic events, hospitalizations, or health conditions or concerns, such as seizures or pain, etc., that may influence the person and supports needed, and relieves the person or family from needing to remember a specific date that a behavior may have occurred. For instance, if the behavior was 3 weeks ago, a month ago, or 3 months ago. Simply identifying that an event occurred or that a need is present is enough. CAS assessments often include several people, for example, the person, family members, peers, agency staff, care managers, or others with knowledge and/or who help with advocacy who know the person well. This slide shows the many things these parties contribute to the CAS process. Providers or staff, or family, if a person's family is involved, are helpful because they have additional knowledge about a person and how they live, their goals, supports that are helpful, and understanding of daily challenges and strengths. People may also have a comfortable and trusting relationship with their staff and see them as a partner in their advocacy. Care managers provide contact information, help consider who should be part of a CAS, and help facilitate the connection between assessors and those participating. They also review the summary of the CAS with people and use it to help inform the person's care planning discussions. The care manager is responsible for documenting questions and, if needed, following up on any questions or concerns. A person's CAS is conducted by trained CAS assessors. All CAS assessors are QIDPs, or Qualified Intellectual Disability Professionals. They have completed a bachelor's degree in a human services related field and have at minimum 1 year postgraduate experience working directly with people with disabilities. All CAS assessors, both state employees and contract staff, complete the same trainings and field readiness evaluations. The next few slides go into further detail about the activities of the participants. Once the person is identified as needing an assessment, the care manager helps identify the people who should be involved in the CAS interview process. Care managers are essential to helping facilitate the connection between the assessor and the person and family or other key or primary support people. Given their knowledge of the person and their supports, the care manager should have the most accurate contact information. The care manager also has an essential role in explaining the importance and necessity of the CAS assessment to inform care planning. The care manager supports access to important documentation. Documentation supporting the nature and severity of the developmental disability, as necessary, is required for completion of the needs assessment. All information is considered valuable and should be made available while a person is in queue for assessment. OPWDD provides guidance on the types of information that are helpful for CAS. The care manager is responsible for sharing, discussing, and documenting the review of CAS summaries with the person and/or family and people who support the person, such as residential providers. CAS summaries can be accessed by the care manager and printed to share with the person or primary support within 3 days of completion of the CAS. CAS summaries must be shared and reviewed within 30 days of a person's enrollment in care management and availability of the summary and choices. This discussion with each appropriate party, information learned and explored, and context related to the assessment and person-centered care planning is captured in the review documentation. A timely review is important to the person and their supports, as it allows for more accurate recollection of the person's strengths, needs, interests, supports, or challenges at the time of the assessment, and allows for needs and goals to be considered and to inform care planning. CAS information must be utilized in the development of the life plan. The information gathered from the CAS assessment is one of the building blocks in the conversation about a person, their strengths, needs, and plan for support. The plan is where all the specific details about a person are captured. Safeguards, supports needed, whether the person is interested in change, individual and/or family goals, and areas for additional assessment if needed are all examples of areas that could be included in the life plan. When people or families have questions about the CAS summary, the care manager has a few responsibilities. They are responsible for the initial review of the CAS summary as previously stated, for the review and documentation of the discussions for care planning, and documentation of any questions or concerns identified from that process, then conveying those concerns either through notes in the care planning meeting or, when needed, to OPWDD via email. Information about this process requirement and the request to review form are located on the OPWDD website, easily found by entering CAS concerns in the search field. Before documenting the concerns, the care manager must fully explore all perspectives of those who support or serve the person in the appropriate capacity and provide context for the question or concern, which is essential for care planning and resolution. If a care manager does not understand the information in the CAS, they should reach out to a supervisor before initiating the concerns process. When reviewing the CAS summary, it's important to understand that the CAS is not the only source of information about a person. Many other documents provide the care planning team with information about a person and what supports they need. Because not every concern raised impacts care planning, some questions or concerns may be noted in a person's records, but not require a change in the actual CAS summary report. Issues that rise to the level of the concerns process should be factual errors in information about the person or their network of support, a significant change in condition that is not captured, or a health and safety issue that is missing. Review of the current life plan or CFA and update or amendment may be necessary to capture multiple perspectives or specific support for independence across settings or as experienced with specific staff or natural supports. Preparing for a CAS assessment interview can result in a more positive experience, and people are less likely to worry or feel anxious. Start by identifying a date, time, and location that is comfortable, convenient, and that supports a distraction-free environment where a private conversation can take place. Identify who is important for the assessor to talk with. Identify key supports, especially when care and support needs may vary across settings. And talk with these people as part of your preparation, or be sure these key supports are provided an opportunity to be interviewed. Review documentation and make sure everything is current. For instance, request updated evaluations or the most recent versions of clinical summaries, reviews, or testing as needed. The best preparation for the CAS assessment is to think about what a typical day may look like and the things you or your loved one does and the help they need, whether it's getting ready for the day, going out, preparing and eating meals, or going to school or work, etc. Talk with others who support the person and think about what is important for the assessor to know. Being able to say what kind of assistance the person needs in general everyday activities is beneficial preparation. And last but not least, remember you can help guide the conversation. Quality begins with the assessment administration process and the standardized, rigorous training that all assessors complete. The inter-RAI resources and OPWDD trainings that are complemented by field readiness evaluations require the new assessor to demonstrate skills, knowledge, and abilities. Once a new assessor is determined to be ready for the field, they continue to receive support from training and quality assurance staff. This additional support continues for up to 30 days or more and provides the new assessor with an experienced subject matter expert for consultation. OPWDD Quality Assurance reviews the results of some CAS assessments in each region to see how the CAS is collecting information. They will observe every CAS assessor periodically to make sure they are performing the CAS as they were trained, including in real time at a CAS assessment. And they will help provide trainings to CAS assessors as needed to improve experiences and results of the CAS. We continue to work with our CAS assessors, CCOs, service providers, and others to monitor the effectiveness of the CAS and the experience of participating in a CAS assessment. Some specific activities include checking in with CCOs to make sure they are utilizing the CAS to inform a comprehensive care planning process, discussing the CAS summaries with people in a timely way within 30 days of availability to them, and administering a post-CAS survey to collect feedback on the CAS assessment from those who participated. We have collected satisfaction information for years that speaks to whether the CAS was a positive experience overall for people receiving services and their families. In most cases, the feedback we received shows that it has been a positive experience. In 2022, we had 98% satisfaction. We have made adjustments to the CAS process based on surveys and feedback, which people doing reassessments should benefit from. First, it's worth noting that we are almost done completing initial assessments on all adults. In some cases, a person has also had a reassessment. So we now have a lot of people and families in our system who have experience participating in the assessment process. We want to assure people that the CAS assessment is not the determining factor in a person's supports and services. Each plan relies on broad layers of information to be person-centered. The CAS is providing OPWDD with important information about all of the people who use OPWDD services. As outlined in the 2023 through 2027 strategic plan, OPWDD has important goals and objectives for our service system, including enhancing our person-centered supports and services by making sure OPWDD services are needs-based, equitable, and person-centered. The CAS helps us plan improvements. It provides OPWDD with large amounts of good information about the people who use OPWDD services. It is telling us about the kinds of support needs that exist among everyone we serve and what services are being used to meet those needs. This is information OPWDD has not previously had about its service system. We can see patterns in the kinds of needs that people experience and how services are used. We can use those patterns as a guide for making sure everyone is receiving the right kind of supports to meet their specific needs and assisting in having equity in the service system. Understanding the needs and services of people relative to each other, who may need more services and who may need fewer services, will help us understand how each of our services helps meet different kinds of needs. The CAS provides us with a great deal of information about each person, which we can look at as a whole and see trends in with the entire service population. Service ranges are an indicator of relative need, meaning they provide an indication of who may need more or fewer services comparatively. A person associated with a lower range might be expected to use fewer services and supports compared to someone in the higher ranges. We can see how many people experience a particular challenge or how often a particular type of support need is identified system-wide. OPWDD's service system must provide each person with the support that is right for them. While every person should not have the same services, they should have access to the services they need. Getting better information through the CAS is helping OPWDD to make this happen. Understanding each person's needs better leads to services that better match each person. In other words, services are more person-centered, needs-based, and equitable. The last point is that the service range that a person is associated with is influenced by their abilities in activities of daily living and instrumental activities of daily living. Let's review those activities to ensure everyone is on the same page. ADLs are things like bathing, dressing, eating, transferring positions, toileting, and walking. IADLs are things like phone use, managing finances, transportation, shopping, meal preparation, housework, medication management, and staying safe. But before we move on, we can't emphasize enough that the CAS is only one part of the assessment of a person's needs, and the service range is one part of what helps inform the types of services a person may need. As we have discussed, OPWDD looks at CAS data for the person to help inform care planning. OPWDD also uses CAS data for everyone to inform our service system. This means that we can use data to better understand the overall needs of people. Like the DDP2 and the ISPM scores, CAS provides information about the people we serve, but in a more detailed way. This is not a new idea at OPWDD or a new way to use our assessment instrument. It is simply an extension of what we've already been doing, but instead using the CAS. We have been studying service use patterns to see the levels of services being used by people who have similar needs, and the research has shown that there are common trends. Therefore, we are using these trends and patterns to develop guidelines that can help predict what kind and amount of services might meet someone's needs. We will be able to know that people within certain age groups and with certain types of needs tend to require a certain level of service. This is not to say that each person in a group of people who have some common traits gets the very same amount of services or even the same services, but we may now have a general idea about what level of support may meet their needs. We want to use the CAS information in this larger way to help us understand the services a person may need and take steps in the future to build the appropriate service system. We are excited to build on our CAS work thus far as we look toward the future of our service system and ensuring people are receiving the supports that are right for them. Some next steps related to our CAS work include collecting and sharing more CAS data with CCOs. CCOs will have the ability to integrate CAS information into existing care planning tools, helping the system's care management practices be more efficient and consistent, and the process of sharing service range information with people so they understand the benefit of our system being informed by CAS. We will continue training and quality assurance measures with care managers and other stakeholders. OPWDD will review our CAS data and the service range information we develop every few years to ensure they continue to capture the relevant needs of people in our service system. These efforts will help us to improve data collection and information sharing, improve day-to-day care management and a person's service planning process, simplify processes for CCOs and providers, ensure our system is meeting the service needs of people with developmental disabilities in a more equitable way by providing information about how well we are or are not serving marginalized communities, and see trends and patterns which increase our understanding of the needs and services of people relative to each other, how each of our services are being used to support people, thereby allowing us to make data-informed decisions about future system needs and changes. Thank you.